What's up, guys? Today is Saturday. My surgery is on Wednesday. The time speeds up so fast. Yeah, 4 days since my surgery. Wow. My lips are no longer as dry as they once were. Cause baby, when they said bring you some chapstick, even when I went home, my lips peeling for like 2 days. I used some type of something I got as a gift and some other stuff. But I don't even know if I showed y'all. But one way that's been helping me get this gas out, of course they say start walking, but I have this massager. I just be like this. Yeah, get all the way back there. I think I keep unplugging here. Alright. And I haven't really, I've been sticking to popsicles and water cups. I sometimes put in protein shakes, Premier protein shakes, because I don't want to just, I need to get in my protein, so you can't just drink water all day. And I have like clear protein drinks, so I try to drink that, but especially the Premier protein because that has more protein in it. And one thing I learned is they say you have to build a tolerance for more and more. So they said each day try to sip a little bit more and more to get your body used to drinking water. Because they said for right now, the water inside of those protein shakes can count towards your water goal, which is 64 ounces, or fluid ounces. But afterwards, like after 2 weeks or so, then hopefully, after 2 weeks or so on, you're gonna have to drink your water separate from your protein drinks and all the food you get in your protein. I had to take off that patch behind my ear because it was leaving me my eyesight blurry. I couldn't do it no more. I was like, I'm in school. I got to read a lot of stuff. I don't like blurry vision. It's not fun for me. But so they gave me all these different medications and they gave me all these different medications that I already have in here. So this is today because it's Saturday. So I already took the ones for the morning. But they told me, they sent me a letter today. Yep, today. And said if I don't have any nausea, begin taking my medications. These right here. But of course, you know you can't take these at the same time. You must take them at least 2 to 3 hours apart. So while I'm about to go ahead and take this multivitamin and go ahead and put it in for the morning time of all of these, I'm also going to write in here somewhere the time frames in which I can take my medications, because you got to keep track of it. Because trust me, you don't want to take certain, like when they say don't take certain things together, they telling you for your benefit, because not only does it not absorb sometimes, like it's fighting for a place to absorb, your stomach can hurt. I was taking iron pills and what else was it? I don't know if it was a multivitamin. It's iron pills and some other type pills. It might have been a multivitamin or something like that. And y'all, I felt like my stomach was about to blow up. Don't do that. Don't make that mistake. So I'm gonna. I have this little marker here that came with some type of set that I have, so it's white. Y'all can see right here. is white. Dry erase. Cause I know what time I'll be waking up, so I'm gonna go ahead and disperse of my, I call it candy, but it's calcium chew. You gotta eat this 3 times a day. So I'm just gonna put this for at night then. Just open it up for at night. And then I'm gonna put it right here for at night, and then one right here. Let me read this book, because I know it says you gotta take it 3 times a day. And I think vitamins 3 times a day. Hold on. So, yeah, I got to take a multivitamin in the morning, right here. So, to take a multivitamin in the morning, calcium chew, another multivitamin, and then a 3rd calcium chew. I wish I had like 5 slots, but it is what it is. So I'm gonna go ahead and take my multivitamin. So this is it says 60 days. This says 60 chewables. This one says 90. They're all for 30 days. I'm about to eat this. So let me take this out for you. I feel like all my thighs just exposed. I remember these big tail things. I barely want to eat food. You think I want to eat this? So we're going to take our pill crusher. Put that bad boy in there. They ain't touching on nothing, that big tail pill. I might have to cut it. I said, dang, what you want me to do with all this? Alright, maybe it'll work now. Comes with this little brush. There you go. I just keep going back and forth, like grinding it up or whatever you want to call it. I'm gonna take one of these medicine cups. Put it in here. Any access I'm putting in there. So alright, this is how we do it. About to take it now. Y'all, thank God for siblings, because I was in a hospital. In order for you to get cleared to go leave the hospital the next day, you have to make sure you're drinking all your waters, writing it down, and go walking. I was in my room for about how many hours until my sister came. And they didn't tell me how to control the TV, the remote and all that was. How to call for the nurse. They didn't show me how to do all that. This was sitting beside me for how long? It was unopened for a while. My sister said, you better use that so you can breathe in it. And she had to teach me how to, cause I was up in there blowing in it when I first opened it. You know, and then I was waiting for like over an hour to go walking. Like that first day, if my sister did not come to the hospital, I would have not walked that whole day. And guys, I was begging like to walk. I'm like, cause they kept saying, don't try to do it like you're on fall risk. So that was like, you shouldn't try to walk on your own. Wait for a nurse, don't even go to the bathroom on your own. But then every time I press the nurse button, wouldn't nobody come to go help me walk. Now, if I needed some medications, that was fine, come bringing it. But I was like, you can't let me walk? What? So my sister had to come. When my sister came, I unscrewed that IV out my hand. Not the whole thing, but it's like a piece of it. I unscrewed it. Put on my clothes, my other robe on top of it, and screwed it back on. Plugged back in all the other stuff necessary that I needed to. And I went walking. I said, y'all ain't finna hold me back. I ain't staying here. Like it felt like every 2 hours somebody was coming up to my room. I was like, dang, how people get sleep up in this hospital? If every 2 seconds y'all up in here. God be sleep. Like, I hear somebody come through the door. I'm like, especially when you see them dragging like a little cart or something. Like, oh my God. What you want now? What you want now? But I kept, when I woke up, I was throwing up. I was throwing up. The nurse kept on, some of the nurses I had favor with, she was like, I was moving like this. Cause I remember moving. I woke up, that was the worst pain I ever felt in my life. I actually had a talk with God. God told me, I'm just gonna prepare you. I was like, huh? I heard, like, you know, this voice of God. God said, I'm just gonna prepare you. He said it's gonna be one of the worst pains you ever felt in your life. I ain't saying this to warn you. I'm not saying this to scare you, but I'm saying this to prepare you. So I was already nervous, like, oh, when I tell y'all, I would not stop moving. I was like, I was like this, flipping, turning side to side. I kept sitting up, and the nurse like, no, I tell you need to stay back. I said, ah. Then I would scream. I said, ah. Yeah. And so then when I came back to full consciousness, my nurse was laughing. She said, I knew you gonna be sweet. You all calm and sweet right now before you before you were acting like that. Listen, I was in some pain. Oh, let me finish taking my multivitamin. But this is my favorite part. I'm really excited to disperse So what's up, guys? I'm here at this food line. Excuse me if I look rough. I know I do. I probably done wore this shirt already in this vlog, y'all. But I threw on a shirt. I took a bath and put on clothes. I literally put on what was there. Anyway, I'm about to go in. I'm about to go get me some yogurt and maybe some pudding. I'm not ready to try any broth yet. I don't want anything savory right now. I'm trying to stick to just sweet and mild or something like that. So I'm just gonna get me some pudding and what I just tell y'all, some pudding and some yogurt, and that's gonna help me also get in my protein goal with that. So not so much the pudding, but the yogurt is gonna help me get in my protein. And the better I get, start on that protein, the better it's gonna be for me. I don't remember if I told y'all. They didn't even let me, when I first came in, I'm just gonna tell y'all this. Excuse my look, girl. I don't like people walking past my car. Cause you got all of the world to walk past somebody else's car. Don't come by mine. But anyway. So they didn't tell me to drink that when I first came in. For instance, so I went with my sister. My sister had the surgery before. I'm not exposed to anything that she hasn't shared already. And so they told her, all right, you can go ahead and drink your pre-surgery shake, and then they're going to come back and get you. Well, when I came in, all I got was stares. Like, they looked like they ain't... Basically, how they were staring at me should have let me know what was to come. And so I will say this. It's better off my experience at the hospital that I was at. The people who did my surgery, wonderful. I can name specific nurses who were wonderful, but overall the rest of the staff, nah. Like, I know how y'all say, well, let me just see if this can stay still. Okay. It's the same where people have bariatric surgery and you're not supposed to say, oh, you don't look like you need it or this and that. So they told me I could be discharged by 1 p.m. Here comes 1:55 p.m. I'm still calling for the nurse. Like, y'all, by this time I done pulled all the stuff off my finger. I done pulled like everything. The only thing was on me was something in my hand. And if I knew how to get that out without causing me pain, baby, they'd be like, where's this patient at? Probably done called the cops looking for me. I would have been at home resting myself. But anyway, you're supposed to walk. They're supposed to get you to walk as many times as possible. I didn't start walking until my sister came. So stuff like that where it's like you're supposed to be able to drink your water and walk before you can go home. They wasn't even making sure that I was doing that. But I did have a nurse that kept bringing me in my pain medication. But for instance, another nurse came in. Because once that nurse clock out, then another nurse has to take over. And I remember one nurse coming up to me saying, oh, because I called for her. She said, yeah. She said, it's 2 more people in front of you that are asking for pain medication. So I'm like, okay. And she's still in my room. So I gave her that look like, can you go help them with their pain medication so I can get my pain medication? I guess she realized what that look was. I'm like, well, what are you here for? Like, go help the people. Like, if they in pain like I'm in pain, and you sitting here being useless in front of my face, I know they're going to be mad when they see you guys. That's the real tea. That's how I felt. I was like, see, this why people like to do stuff. They don't be listening to doctors and doing stuff like that. Because they feel like they could be more useful with themselves, even in pain, than what some of these nurses. I'm like, if I could have got it myself, I would have 100%. And then it took them forever to find a bed. But that's that hospital because they did the same thing with my sister. I thought I was going to have a better experience. I mean, when you knocked out. But yeah, it was just weird. Then after I had to ask them twice for a wheelchair. At this time, they done released me, took the IV out my hand. All I need is for somebody to come and get a wheelchair to carry me to where I need to go to. So it came to a push and shove. I was like, you know what? Bump it. I found a nurse in the hallway. I said, I don't need the wheelchair anymore. I'll just start walking. She said, yeah, it's been taking a long time for them to transport people. She said, just stop by the front desk and tell them that you're, willing to walk. But she was like one of them people where she like, girl, I know they don't be doing their job. Girl, just tell, Like, dang, I really wish I could do that for you, but she might not be the head nurse. You get what I'm saying? And so I go up to the head nurse. She look like Medea height. I'm not even trying to be funny. I'm not trying to be funny. And she was like, so the man, I told her what room I was in. So this man was like, oh, well, we just got a wheelchair right around here. And so then I'm sitting down, and she's like, you the Barry patient, right? I'm like, yeah. She's like, you don't look like you need the surgery. I don't know how to take that, guys, because especially when people are bigger than me, and it's like somebody being smaller than you and saying they need to lose weight. If they feel like they need to lose weight 9 times out of 10, even though they're not comparing themselves to you, you probably need to lose weight too. Like, let's be honest. I'm not even trying to be funny, but it's like, sis, if I qualified for surgery at this weight, you most definitely can qualify for surgery or just a new lifestyle. I'm not even trying to be funny. Like, people say that just so you can like, no, you don't need to lose some weight, or no, like, it was like cosmetic. No, my dog, I had to go through a 6-month process, go through all these classes, go through all this weight stuff. So yeah, like, and she was a black woman. I'm just gonna say this. I don't want to keep making it about race, but I'm just say this. A lot of black people, and that's I'll speak on it because I'm Black American. A lot of Black American women don't realize how big everyone is. They think because a lot of us are surrounded around other big people, and specifically women, but a lot of big women, a lot of black women, Black American women don't realize how big we are. And we think that, what is that sound? I hear like an alarm going off. But so we always think that everybody, no, you don't look that small to be getting surgery. Like, you're not supposed to have a double chin. You're not supposed to have big giant rolls, a big back, and a big stomach. You're not supposed to, you know, them thunder thighs. It's one thing you got thicker thighs. It ain't supposed to be shaking. You're not supposed to be having like bat wings. I'm not even in my 30s, guys. Like, what is this? You're not supposed to, that's not, it ain't a shape that is healthy. It's a size. It's based on your height and your weight. So when people be saying that, and then she kept asking me in front of everybody, well, do you got a health condition? I'm like, no, ma'am, I don't have no health condition. Well, do you have arthritis? Because I told her I want to get the weight off my knees. She was like, do you got arthritis? Like, she was trying to look and find some reason as to why I was having surgery. I'm like, man, we big. We big. We out here looking like, what you call it, the yellow bird. Looking like Big Bird. Up here we big. We look like the size of Medea. That is obese. Okay? I don't care how many women up in your family you see that allow you to stay that way. I ain't gonna be one of the people that lose weight and just be joking people, but I get real about it. Cause I done lost 60 pounds before this surgery. Listen, we big. Y'all keep lying to yourself in your head, telling yourself y'all not big and you're obese. Okay? So she just looking for some reason, like, wow. I'm like, that BMI was 40 and above. I don't have any health concerns. Not on no high cholesterol, no high blood pressure, no diabetes, not even pre-diabetic, none of that. That BMI was over 40, and I got approved. That's how I got bariatric surgery. I always say bariatric. While I drink my Bariatric Advantage, clearly protein drink. But thank you guys for listening to my rant. I'm about to go in here and get what I need to get, and so I can go home and eat my food, because I'm starting to be able to, y'all see how many times I done sipped this? I'm starting to get in a lot more sips than I usually would. So I'm gonna go in here and get some pudding and some yogurt and maybe some Gatorade Zeros, and then that's gonna be it. I'm not worried about any soup right now. Oh yeah, and some popsicles. I need to make me a list. Bye, y'all. What's up, guys? So I'm here, y'all. If y'all see a stain on my bed, excuse me. Of course, I have been eating on my bed. I dropped some chocolate pudding, so it probably looked like something else. That's not good, but So I'm going on TikTok. So you know how you do all your research, and I look, and they had to bypass like me, but they were like 3 days post op, and they were getting in like 4 ounces. Guys, I ate a popsicle, and let me show y'all a popsicle stick. You know, like the popsicle's only a little bit on top of everything. And I got scared because I was like, I don't know if I'm full or not. I don't want to keep eating till I throw up, because with the bypass, you're more prone to throwing up and nausea. So I was like, baby, I'm not trying to be out here throwing up. So I threw the popsicle away, even though it's half up on left. And I had to ask my sister, I was like, baby, baby sis, how do you know if you full or not? But she said people start burping, hiccups, or sneezing. Well, no. It was that, and your nose start running. I was like, well, I can't stand no hiccups. So Lord, let me have no hiccups. I don't like I don't mind burping, but I don't want to have all that extra gas. But if anything, I'd rather deal with sneezing. I don't want no runny nose. But I don't think you get to choose. But the reason I'm recording right now was I was thinking I ate a popsicle today. Well, a popsicle, a whole 1.5. I had some water today. I bought me some Gatorade, which I told y'all, but I had poured it in a 1 ounce cup, and I took a sip of it, and I said, something fell off. Something feels too sweet. I looked back at that Gatorade, and it was regular Gatorade. So now I opened one, so it's like a 2 6-pack. So I could take one back, and the other one, I don't think they're going to let me take it back, so I'm going to just give it away. I got to exchange that because I need my Gatorade Zeros, but you're supposed to have your protein over your Gatorades and other drinks. And I have been feeling real dehydrated, but I have not really been getting in any protein. And so I'm going to go ahead and try to get in this and just prioritize getting in my protein. So I think you're supposed to get in like, maybe I might need to have to read that again. I think it's 64 ounces of protein. Well, they say a number, but it's pretty much as you possibly can of protein in these like first few days or first few weeks. Try to get in as much protein as possible. So I'm about to pour that Premier Protein into some 1 ounce cups and balance that out and see what I can do so I can just get in my protein. I'm gonna start trying to get in 2 of these. They said 2 to 3 shakes a day. We're gonna aim for 2 right now because I'm not even hungry. So I got to force myself to drink that. I'm not even hungry right now. That's how I feel like. I woke up this morning asking myself, because this is why I was on TikTok and I was looking at recipes for the puree stage, and I went to sleep on that. And then I woke up thinking I'm about to eat some lasagna. I don't know why I did that to myself. So I woke up, I said, I'm about to go ahead and eat me my lasagna. Then I said, wait a minute. 2 things. Number 1, I'm not at the puree stage. Number 2, and that was 2 days post-op. I'm 3 days post-op. Then on top of that, I didn't even have no lasagna. So what? It was weird. So I'm about to get in this protein shake and try to drink as much as I possibly can. And I'm just going to stay to the sweets, the protein shakes. And when they say your taste buds change, it really does change, because this was good when I first sipped it before surgery. I sip this now. It is not good. It is not good to me. I'm trying to take my stool softeners. It ain't really do nothing for me. Cause I'm not. What am I eating really? Pretty much that you had to go to the bathroom besides pee or something like that. I'm not taking nothing that's just super thick. But I will say this. Hold on, let me place it right here. So I showed y'all in one of them videos that I had already put my vitamins in my chewables in here. I know y'all like 3 days post-op. I'm confused because everyone else, all the doctors been saying, don't take it till a week afterwards. But then in my chart, they sent me a message saying, if you haven't already, go ahead and start taking your multivitamins and your calcium chews. And I'm just like, okay. So I don't just take it and just bite it one bite. I take small little bites. Try to get it down. Even when I do the chewable, small little bites. I don't do big giant bites. To get it down, because sometimes this be making me feel a little bit full. I told you I got full. I felt full off a popsicle, or if that was the feeling of full, I don't know. But I'm not hungry. I be having an appetite for certain foods where I want to be satisfied, but I'm not. I don't feel like I'm hungry. I want to eat a whole bunch of everything. But raspberry, I told y'all raspberry was my favorite, and then we have orange here. I don't have strawberry. But lemon has been tasting the best. That was the one that I felt was going to be the worst one. So I started saying, let me go ahead and eat the lemon first. And actually, it's by far my favorite. And so I was like, dang, that's... Considering that drink I just showed y'all, and then me talking to y'all about this lemon chews, and that being one of my top favorites. Okay, I'm like, okay, your own taste buds really do change. And these right here... I'm about to try the caramel. I haven't tried one. This will be my first time trying the caramel flavor post-op. But even when I had the vanilla Premier Protein shake, it tastes super creamy like ice cream. So, yeah, I'm about to fill up mine and then drink it. And I got these off of Amazon. So I don't like to be too wasteful. I like to reuse. I don't just throw them all the way away. If I can reuse it, I'm going to get out like 4 of these. That's how I do it. I measure them out. I know, okay, if I'm using some for milk, and these are my milk ones, I'm going to keep doing that. Refilling all 4 of those until I can get done with my milk. And then move on to something else. I also have 4-ounce cups, but that is, let me see. So we got our 4 1-ounce cups. So I'm about to pour this in here. And one thing I want to tell y'all too is all that stuff I packed in my bag, I ain't used. The only thing, y'all, I ain't even used my charger, the extension cord, no lip gloss, no deodorant, not even the, y'all, I ain't used nothing. I'm just be honest with you. I ain't take a bath or wash up white nothing. What I mean by that, like, just super clean anything until I got discharged and went home the next day. So, I don't know, something. When I got out of that hospital, I felt better. But I ain't used anything. Not to change your clothes, not the extra pillows, not the extra blanket, not the extra sock to change your clothes, the charger, extension cord. I wasn't on my phone. I wasn't responding to anybody. So therefore my phone wasn't getting used. So the battery stayed charged. I didn't use the bra that I purchased. All I used was a robe to, you know, cover and protect the back of me when I would go to the bathroom, because you don't really get no privacy in that area. So let me pour this. And this is how many fluid ounces? 11 fluid ounces. So I got 4 more and then 3 more. Tastes so sweet. I'm glad I only got one of those. The cookie dough I could get down. The vanilla I could get down. This tastes like a nutty. I'll let y'all know how it goes. Hey guys, so I know I look rough right now. Excuse me, I'm taking out my hair because anyway, I'm gonna get to that later. I just want to give y'all updates. So today is the 1 week anniversary of my surgery. So today is Wednesday, and what I'm about to tell y'all. I'm doing a lot better. I'm walking around a lot more. I feel a little bit way more healed up. Of course, today I'm supposed to start my medicines. Also, what happened? Yeah, all that medication. But I lost 9 pounds, so I weigh 244. So officially 9 pounds down. And today I saw somebody else do this. I got the traditional Panera bread broccoli and cheddar soup, but that is not the best for me because it has dairy. But you can strain it, loosen it up. That's actually from Panera bread, so it's a lot more looser. Oh yeah, that's what I was gonna say. So I'm gonna show you my incisions, but I don't want to show y'all my incisions. Alright. So here's my incisions. I'm just gonna show y'all a few of them. Here's my incisions. Here's another one right here. And they look worse than what they really are. And that's about as long I'm gonna show y'all right here. Excuse me. But that's how it's doing. It's healing up. Oh yeah, then right here, it's kind of peeling up a bit. The best way I could show y'all. But I bought some incision covered, like waterproof, because they told me not to be in like a bathtub or submerged in water. Well, I'm getting baptized next Sunday, or this Sunday coming up, and I mean, I'm not gonna be in the water too long, but I'm gonna get that to protect my incisions. And pretty much that's the update for right now. I got one more week. I know that's another reason I'm losing a lot of weight, because I'm not eating like I supposed to, because I don't like all these different, I don't like broth. So I'm eating these soups, and only specific soups that I like. And I told y'all that dairy is doing something to me. So I'm eating when I can. I'm getting in my protein shakes and some of my protein shakes. I'm gonna think about buying the powder so I can get it in, or the seed. I think it's Seek or Seed. It's some type of brand that everybody like to drink or get. I think I'm gonna think about getting that brand, so it's like almost like I'm just drinking regular old sports drink or something, but also getting in my protein. That's been a little bit easier on me versus these protein shakes. Is not it's just it's so thick. But when I drink protein waters, it's a little bit easier on me to get down. And popsicles have been carrying me all the way through, for real. And so when I'm off this liquid phase, I feel like I'm gonna be a lot more better at keeping more track of my meals. So I can't wait for the puree stage. I already got the meals saved on my TikTok, ready to go. I'm about to go on Amazon and start buying up everything that I need, or just create my shopping list, because I'm so ready. I got one more week, then I'm on parade food, so peace. Hey guys, so I just wanted to go ahead and end this vlog. So this is the end of the vlog for my full liquid diet. I have 3 more days, so today is Monday, and it will end on Thursday, because I was thinking like 2 weeks from my surgery date, but no, that's full liquid. So it'll be from Thursday. They told me the next day after I went home, start full liquids. So technically it'll probably be like Thursday, Friday. I've been doing some of the same things. Being so like on the other end of my full liquid phase, whatever you call it, I feel a lot better. I'm able to drink water. I'm not able to gulp as much. Then protein shakes, I can get down like a good amount. It's like, one thing I noticed is certain foods you can get it down, then other foods it's hard to get it down. So, but me being at home, I just been buying. So I bought this. I was on Amazon. I was looking up stuff to stop like scars or take away those, because you know them spots gonna get a little bit darker. And so I was thinking about how to just minimize the existence or the visibility of the scars, the incisions. So I got this. It came in like a 2-pack, and I was looking up like Amazon reviews. So hopefully this works for me. It better work for me, but hopefully it works for me and fades the scars and helps it. So that could be minimized. I have, how much weight have I lost? Hold on, I'll be right back. I weigh like 241. So that's roughly about 12 pounds. Yeah, about 12 pounds. I have lost, so it's been how many days? About 12 days, 12 pounds, or 13 days. 12 or 13 days, 12 pounds. So about a pound a day I've been losing. And it's been 241 for about 2 days, so I don't know what's going on with that, but that's how it's been. So this is the end of the vlog. I signed up for a gym membership, just a trial until I get to my other gym, but I'm about to start going to the gym a lot more. I'm not cleared to go to the gym, but I'm gonna just start doing it. And not doing as much as I was doing, but at least getting on the treadmill and walking. Because me being at home, I ain't walking, I ain't moving. Baby, I be in this bed laughing at my phone, all up on my phone, watching TV. Listen, I need to get out the house. So that's that. So peace, guys. Stay tuned and watch the next video in the series. Bye.